No.
Indiana is in the midst of a crisis. Mothers and babies are dying at an alarming rate in our state.
And Governor Holcomb made reducing infant mortality one of his top priorities this year, as Indiana ranks one of the worst in the country.
Call 6 Investigates Stephanie Wade is here with us now.
And she traveled to communities impacted the most by this and is digging into why the Hoosier State is so dangerous for pregnant moms and unborn babies. Stephanie, what did you find out?
Mark and Amanda, one of the largest issues we face here in Indiana is our maternity care deserts. Listen to this. Data from the State Department of Health and the CIA show women in Iraq and the Gaza Strip have a better chance of surviving childbirth than women in the 33 Hoosier counties without a hospital or an OBGYN physician. Call 6 Investigates found thousands of women are having to travel out of county to be seen by a doctor, making them more at risk of death. It's a story you'll only see here on RTV6.
Today is the day. While nervous, you feel a sense of comfort, knowing you made it safely to the hospital and you're surrounded by doctors as you await your baby's arrival. Some might say this is what an ideal delivery looks like. But for women who live out here in rural communities, this might not be their childbirth story. Rather, theirs is filled with anxiety and the possibility of what can go wrong.
It's hard because we have to drive clear to Lafayette.
Ashley and Rodney Newkirk, expecting twins soon, live in Crawfordsville.
It's a good 45 minutes to the hospital that we'll be delivering at. And that goes the same for like a real ultrasound. We have to go for that 45 minutes as well to get the ultrasound tech.
For Caitlin Catterson, who lives just 30 minutes south in Waveland.
It's an hour and 15 minutes away. I'm going to be in labor on our way to the hospital.
Both women have a high-risk pregnancy.
I have pre-diabetes, but I think right now they're watching me to make sure that he doesn't develop gestational diabetes.
Both live in Montgomery County, one of the worst counties in the state with access to care. The only hospital there quit delivering babies back in 2011. For them, the nearest OBGYN is based in Lafayette in Tippecanoe County. That's where they'll have to travel to deliver their babies.
The ambulances were delivering babies tenfold from what we were when we delivered here.
Call 6 Investigates found 33 out of Indiana's 92 counties either have no hospitals or the hospital has no OB services where women can receive medical care before and after pregnancy, meaning women in more than a third of our state are living in maternity deserts.
The numbers of hospitals that actually provide OB care are decreasing, and then the acuity of our patients is going up. So it's like this perfect storm of worsening, more acute patients with less resources.
When you're living on an income that is not, substantial, and you have to make a decision between spending your gas money to go to the grocery store or going to an OB appointment, that's a decision.
Experts say we find ourselves in a statewide crisis where Indiana's maternal mortality rate is the third highest in the nation, and our state's infant mortality is the 7th highest. Getting adequate prenatal care is critical in preventing death.
It is difficult to get good quality providers that want to come here and stay here.
So why are hospitals closing their doors? Turns out it all comes down to money.
NICUs are very expensive to staff, if you can find enough staff for them, so you have a shortage of neonatologists, and then the facility is excruciatingly expensive.
And there's just a lot of those hospitals that do not have the resources to do that.
People are coming up with their own solutions, though. Community paramedic Darren Foreman has decided if women can't get the care they need, he's going to bring it to them.
Tell me we can buy some prettier weather.
Darren leads Project Swaddle in Crawfordsville, where every week he drives 2 patients in rural areas and sees them at their home at no cost to the families.
Any problems?
And it's not just Darren. Franciscan health nurses based in Indianapolis have created their own training program for when things go wrong and you're an hour away from the nearest hospital. Training paramedics in rural communities using a breathing, high-tech mannequin to simulate real-life emergencies they'd experience in transit.
With a pregnant mom, you know, she could deliver in the truck for them. She could have bleeding. I mean, there's just all kinds of stuff that they've got to be prepared to manage.
Because to them, leaving a gaping hole in services for women across the state.
This is not a problem that's going to go away.
And both programs I highlighted there, the Franciscan Health Paramedic Training and Project Swaddle, are both funded through grants they obtained on their own. They need more funding to help more communities throughout the state.
So, Stephanie, this is obviously a big issue. What is the state doing about it?
Well, I took what I found out through this investigation straight to the governor and the state health commissioner. And tomorrow night, right here on the news at 6, I'll show you what they had to say about what's being done to save more moms and babies.